Good afternoon. In India, approximately 18 million people suffer from blindness. Out of 18 million, 80% of the blindness is curable or we can prevent. Most common cause of blindness in our part of the world is cataract, glaucoma, age-related macular degeneration, diabetic retinopathy and refractive errors. Cataract is usually a age-related problem. Usually it's a senile cataract, or in some people because of the diabetes, uncontrolled diabetes mellitus, people can get early cataract. Usually our lens is clear lens, but due to this aging or diabetes or injury, that transparency will go and the opacification will come. That we'll call it is a cataract. Cataract blindness is preventable, or that is actually a curable disease. As a minor operation, the cataract lens we will replace the intraocular lenses inside the lens. If everything goes well, people will get very good sight after following the surgery. Other most important irreversible blindness is glaucoma. Otherwise, we will call it a silent theft of the vision. Usually, glaucoma is as a symptomless or sign. There is no any other symptoms. Patient is unnoticed with this glaucoma. Finally, patient will go for blind. For that, only one advice: all the people should do the thorough ocular examination after 40 years of age. If you are treating early, we can prevent the blindness because of the glaucoma. Then third one is age-related macular degeneration. Usually that you can see in the older people. Now the life expectancy is increased. Then the diabetic ARMD, short form ARMD is also getting more, affecting more in the older people. The treatment, that is usually if it is a scarring, you cannot do much for that. But if you are in the choroidal neovascularization, that we can prevent or we can cure it with the intraocular injections. Or if you are a low vision, you can use the low vision aid. Other important cause of irreversible blindness is diabetic related eye disease. That it's a diabetic retinopathy that will affect in the blood vessels of the retina because of the uncontrolled diabetes or hyperglycemia. So if you are controlling the diabetic or blood sugar, it won't affect in your eyes. For that, you should have the periodic eye examination, then strict blood sugar control. If you have associated hypertension or nephropathy, you should definitely go to the ophthalmologist or eye surgeon to detect the diabetic or bleeding. If it is early stage, if you are controlling the blood sugar, it should not go for the severe stage. In the severe stage, we can go for the laser treatment to prevent the further damage. Same time, you should control the blood sugar. Then the that is the refractive errors, that we can correct with proper spectacles. If you are a children, if you have the refractive errors, you should treat very early, otherwise the eye will go for lazy eye or amblyopia. In the later stage, if you are using glasses also, it won't any use. So for that, all the children, the school going age, you should go to the optometrist or ophthalmologist to find out any refractive errors is there. If any refractive errors is there, definitely you should use the spectacles